Hi, everyone. This is Courtney Spitzer, the project coordinator for our Early Psychosis Learning Collaborative. Please feel free to introduce yourself in the chat box. Now, I just want to review a few housekeeping items before we begin. Next slide, please. Participant microphones have been muted at entry, and you will be able to unmute them during the discussion portion. During the presentation, if you have any technical difficulties or questions about the topic, please use the chat box. This webinar is being recorded and will be available for viewing at a later time on the MHTTC website. To reach us after the webinar, you can email newengland@mhttcnetwork.org. Next slide, please. This slide provides a description of our disclaimers for MHTTC. Next slide, please. The MHTTC network uses affirming, respectful, and recovery-oriented language in all activities. That language is strengths-based and hopeful, inclusive and accepting of our diverse cultures, genders, perspectives, and experiences, healing-centered, trauma-responsive, inviting to individuals participating in their own journeys, person-first and free of labels, non-judgmental and avoiding assumptions, respectful, clear, and understandable, consistent with our actions, policies, and products. With that, it is my pleasure to hand it over to Dr. Machiri Keshavan for introductions.
Thank you, Courtney, and good afternoon, everyone. I'm going to share my slides, which are very few before our main speakers will present today's featured presentation. As we all know, the current period is a highly stressful one around the world, and the series of wellness related presentations that we are featuring through the MHTTC, the Mental Health Technology Transfer Center, is designed to help individuals, especially those who are in the frontline healthcare workers and first responders, to develop tools of building resilience during this period of pandemic, which continues at this point unabated in the United States, especially among the unvaccinated. It's important to address both the risk factors for this ongoing pandemic, but also build protective factors, as you see in this slide. As you think about the risk factors, there are several of those, which include, of course, the risk of the virus itself in the illness and among the loved ones, but also the risk of comorbid medical illness, the implications of this pandemic on our work related life, burnout situations, job loss, the schools closing, the worries about sending your children to school, the problems with sleep, being stuck at home, social distancing, loneliness, fear, misinformation, even the stigma of being ill, and of course, the ubiquitous problems of disparities in care across ethnicities and race. So, we're dealing with multiple stresses at this point. But there are also a number of protective factors that it's important for us to understand, which include aspects of our lifestyle, such as physical exercise, sleep hygiene, integrated care that takes into account both the medical and the psychosocial aspects of health, enhancing our social connections, and also particularly in relevance to today's talk, the aspects of how we train ourselves to think positively. These are all the aspects of reducing risk. And we all wish that the protective factors would balance against the risk, but the fact of the matter is that the risk is huge. How do we manage to keep our balance in the middle of such a risky period? And that is brings up the importance of working on our core strengths, of improving your resilience in such a way that despite major risk, we can manage to move forward and maintain our health and well-being. And that brings us the question of what are those resilience building approaches. In this series, we have previously addressed several of those, including yoga and mindfulness, acceptance and engagement approaches, and relevant to today's talk that will be presented by Dr. Yan and Fu, positive thinking. So, at the top are the sessions that we have already had on acceptance, commitment, yoga, mindfulness, and a very good session last week on how music can help us build resilience. And today, Dr. Yan and Fu will present approaches to thinking positively. And following on this, we will have subsequent sessions on art and wellness, sleep hygiene, and spirituality, and so forth. So, with that, let me briefly introduce Dr. Shirley Yen, who is a senior faculty member, associate professor of psychiatry and psychology at the Beth Israel Deaconess Medical Center. She is and also the training director of clinical psychology training program at Mass Mental Health Center. Her research program has been in the area of suicide risk assessment and intervention, and her most recent research has focused on integrating aspects of positive psychology to enhance resilience and well being. Dr. Cheryl Fu, who is the co presenter today, is a PhD candidate in clinical psychology at Columbia and a clinical fellow at Mass Mental Center and Beth Israel Deaconess Medical Center, Harvard Medical School. Her experience is in the area of global mental health and implementation science. Dr. Fu is committed to developing and implementing scalable psychosocial interventions for under resourced populations. Her dissertation research investigates risk and resilience factors influencing burning out and psychological distress among humanitarian aid workers. So, without much further ado, let me pass this on to Doctors Fu and Yan. Shirley. So, let me
Thank
stop
you.
the slide
Yeah.
here. Yeah, just a second.
Wonderful. Thank you. And Cheryl, if you can advance the slides to our objectives. Great. Thank you. Thank you, everyone, for joining us today. It's really nice to see so many of you from different parts of all over the country. So our three main objectives for today are to first understand the psychological impact of COVID-19 from a disaster trauma lens. And then we're going to describe the benefits of developing an intentional practice of attending to positive emotions and experiences. And finally, we'll explore some domains of long-term post-traumatic growth for healthcare workers affected by COVID-19. Next slide. First, I'd like to start off with a poll question for us to better understand you and your current practices. So, great, thank you. So if you can please respond yes or no to this poll question, and then share with us in the chat box what practices you do engage in or what are your barriers to practice. That would be great. And I'll just give everyone a minute to do that. Take a look at the chat box. Oh, great. So we have quite a smattering, almost an even 50-50 split between those who do have a practice and don't. This is great, getting some of these we will be talking about in greater detail. And, but I also see that some people have mentioned that time is a barrier. So we're going to talk a little bit more about these. Thank you for the comments. But first I want to first hand it off to Cheryl to discuss the psychological impact of COVID-19 from a disaster trauma lens, and then we're going to get back to some of the activities that were mentioned. So, great. Cheryl, you're on mute.
Thank you, Shirley. My research in mental health and humanitarian emergency settings have provided a really useful way to understand our collective psychological experience of the COVID-19 pandemic. And I think understanding the pandemic through a disaster trauma lens can provide us with insights about how individuals and communities respond to and also recover from emergencies. So as you can see here, this is an image by the WHO of the different pandemic phases that we transition into over time. And even though it's a unilateral arrow there, the reality is that disasters don't follow a linear pattern of progression. In fact, we have been experiencing the pandemic more in cycles and waves. And just as there were encouraging signs of a transition out of the pandemic, we are now maybe back at the alert phase of the newly emerging strains of the virus. And I think what's unique about this pandemic emergency is that there is no end in the sense of a natural disaster cycle. And its protracted nature makes it a constant test for our ability to adapt and stay resilient. And we know that there is a parallel mental health epidemic during this COVID crisis, and healthcare workers are at a higher risk for psychological disorders compared to the general population. While a lot of attention has been placed on psychopathological outcomes such as PTSD, secondary traumatic stress, depression, anxiety as a result of traumatic loss or grief, it's also important to pay attention to the occupational stress injuries that are the result of chronic stress as well as moral dilemmas. Healthcare workers, especially those who serve on the front line, are not only at a higher risk of exposure to COVID, but also have overwhelming work demands. Dealing with an infectious disease also places unique limitations where healthcare workers are unable to access their usual coping strategies and social support from their personal lives. They may be afraid of exposing their family members to the virus, for example. And this can result in an accumulation of occupational stress over time, which can lead to burnout as well as moral injury, which I will elaborate more on. So burnout was recently recognized in the ICD-11 as an occupational syndrome characterized by 3 dimensions that were theorized and tested by Masklash and colleagues. It comprised of emotional exhaustion, which are feelings of being emotionally drained and overextended, especially by the emotional demands of the job. Development of depersonalized or cynical attitudes towards the people who are the recipients of one's service, and also lowered personal accomplishment, where one feels a decline in one's feeling of competence and feeling less successful professional achievement in their work. More recent occupational health research with humanitarian workers as well as disaster relief personnel have found that it is the chronic stressors at work, such as workload, the high pace of work, the interpersonal stressors at work, over the potentially traumatic events that have a greater effect on burnout and psychological distress. Burnout is thus a more common and primary source of concern among emergency responders as well as healthcare workers. And it's these subsyndromal stress responses that have been shown to have a longer lasting effect than acute psychopathological outcomes. So for example, 2 years after the SARS outbreak, healthcare workers who treated SARS patients did not have elevated rates of depression or anxiety and PTSD. Rather, they had elevated rates of smoking and drinking, negative coping behaviors, absenteeism at work due to stress and illness, decreased face-to-face contact time with their patients, and decreased working hours as well. And we may expect the same for healthcare workers affected by COVID. Moral injury is also particularly salient for healthcare workers during COVID. The work on moral injury first came out from the work with veterans from the National Center of PTSD, and it's used to describe how individuals may act outside of their moral values, expectations of themselves during highly stressful circumstances. It's highly associated with PTSD, although conceptually distinct, and you can have moral injury without PTSD, but they share similar features such as feelings of guilt, shame, anger, betrayal, and loss of trust. And often, like for PTSD, what is most distressing or disturbing to the individual may not be the graphic details of the event itself, but what the event says about them. They may question themselves, what does making this choice to act or not act in this way say about me? And healthcare workers during COVID may have had to make sacrifices and choices between their work and family, such as staying away from their family to keep them safe from the infection, or having to spend more time taking care of their patients than maybe a sick family member. They may have had to make decisions about life and death based on limited resources, such as who gets the oxygen tank. And we also know now that the ICU beds are filling up with COVID patients, and there's a long waiting list for surgeries. They may also have had to work despite the risk. They may feel guilty for not having as much compassion or empathy as one should, as a nurse, as a doctor, as a psychologist, or having as much compassion or empathy as one usually has pre-pandemic. And they may also feel guilt for surviving in a time of great loss. Collectively, we are experiencing an emotional roller coaster ride with COVID. And this image shows the common emotional responses to disaster as seen in public reactions to natural disaster as well as terrorist attacks, including the September 11 attacks. And we may experience the same emotional life cycle for COVID. For example, at this very start in the advent of COVID in the US, we experienced shock and panic, and maybe some disbelief and denial as well. And as we see the community's response to COVID and things improving, there was a heroic and honeymoon phase where we experienced a sense of solidarity, community, and purpose. Neighbors and communities came together to help each other out with errands and donations. We cheered for frontline workers each night. And as you can see in the timeline, the disillusionment and working through grief and reconstruction phase takes much longer and comprised of ups and downs and mixed feelings. And as we continue to find our footing for a new normal, we may feel a lot of uncertainty, anger, confusion, guilt, helplessness, a loss of confidence in self-efficacy, exhaustion. We hear pandemic fatigue a lot, depression, resignation. At the same time as we experience feelings of acceptance, being open to new experiences and exploration, greater hope and faith, meaning making, more clarification of our priorities and values, strengthening our bonds and relationships. I'd like to take a short pause here to reflect maybe, and you can put your answers in the chat box. Where would you place yourself emotionally on this graph? And what are some of the words you use to describe your experience and how you felt over the past pandemic year? Mm-hmm. Yeah, definitely a range of feelings and around the disillusionment, working through grief and reconstruction phases, right? And that may be the same or maybe a little bit different than 3 or 6 months ago. Yeah. Thank you for all your comments. Please keep them coming. Yes. And when we do take a look at our emotional experiences, in fact, there's a fluctuation of both positive and negative emotions coexisting, right? And how can we thus attend to and enhance positive emotions and experiences? I'll hand it over now to Shirley to elaborate on the benefits of positive affect and how to build that into an intentional daily practice.
Great, thank you so much, Cheryl. So as Cheryl mentioned, even in times of disaster and stress, we can experience both positive and negative emotions. But we do have a bias towards negative emotions, and that's because from an evolutionary perspective, negative affect is quite protective in that it focuses our attention on a perceived threat. So, for example, we all know fear and anxiety tells us there's a potential danger in our environment. Sadness focuses on a potential loss. And anger tells us that someone may be threatening or harming us. So while negative emotions are protective, we also haven't evolved to adjust to present day circumstances in which most of our negative feelings aren't necessarily about life and death situations. But what's unusual now is that in the current pandemic, many of our fears are about life and death. So everything's become much more escalated. So as an example, there's a great deal of anger right now towards the unvaccinated because there is a belief that they are putting others at risk, whether through it's a transmission risk or taxing the healthcare system or allowing potential the virus to mutate. And in times of stress, when our attention narrows on the perceived threat, we do have a tendency to discount any positive or competing stimuli because from an evolutionary perspective, those may have been dangerous distractions. Next slide. But just as negative emotions have important functions, positive emotions may have a very important and opposite function. So according to Barbara Fredrickson's Broaden-and-Build theory of positive affect, positive emotions serve to broaden our attentional scope, allowing for novel thoughts and more creativity, better problem solving, building personal resources and social support. And these experiences are also generative in leading to more positivity, building resilience, and also enhancing our survival. Next. So in fact, social psychologists for the past 20 years or so have been building evidence for this theory. So in laboratory studies using experimental paradigms where they assign participants to receive a positive mood induction or a neutral mood induction, and then asking them to do a task, they found that on average, those assigned to positive mood induction demonstrate better outcomes across a wide range of tasks. So for example, they tend to have increased visual attention awareness, so literally broadening of attention scope. And they found this on behavioral tasks using eye tracking and neural imaging. They have increased thought action repertoire, so more likely to act on a thought. Faster cardiovascular recovery, better facial recognition, more broad-minded coping, creativity, behavioral flexibility, openness to new experiences. They found that those who had a positive mood induction tend to rate their close relationships as being more intimate. They tended to have higher trust in acquaintances, and they also demonstrated less racial bias. So these are all areas that tend to promote more adaptive social and cognitive functioning. Next slide. So Fredrickson and colleagues have also advanced the idea of a positivity ratio, that to overcome the potency of negative affect, we have to have a higher ratio of of positive affect, ideally 3 to 1. And this is in part attainable because the modal human experience is a mild positive affect. Now, a parallel to this positivity ratio comes from the large body of research conducted by John Gottman and his colleagues and couples. So through watching numerous hours of videotaped interactions from thousands of couples, they observed that it wasn't fighting or negative interactions per se that led to marriage dissatisfaction, but it was actually the balance or ratio of negative to positive interactions that was really important. So Gottman uses the analogy of an emotional bank account in which positive interactions are like small, consistent deposits, but negative interactions are like big withdrawals. And he found that happy couples have a ratio of 5 to 1, positive to negative interactions. But the key in this research is that the positive interactions are usually small acts or gestures, that those have relatively the same deposit value as a big over-the-top a positive gesture. So now if we were to extend this body of research to apply to individuals, what this might mean is that, well, maybe it's not about the stress or negative feelings that are problematic, but it may be the imbalance between the positive and negative that's problematic. And so rather than targeting the stressful conditions or negative emotions, which can be really difficult right now when so much is out of our control, we can try to intentionally increase the positives. Next slide, please. Thanks. So you've probably noticed that the positive psychology movement, which started in the 70s, have really gained quite a bit of traction in the last decade or so, particularly in popular culture. But it's arguable that the hype has really gotten ahead of the science. And I don't know about you, but almost every other day I get a story in my newsfeed about how to increase happiness. Next. And quite appropriately, there's been some backlash to that. The reality is that positive psychology interventions are relatively understudied and should be critically evaluated. Next. So now one of the forefathers of positive psychology is Martin Seligman, who developed the positive psychotherapy intervention. And the techniques on the left are all components of Seligman's positive psychotherapy. And some of these strategies have been evaluated independent of the overall intervention. So they have varying levels of empirical support. And notably of these gratitude, which I saw many people practice on a daily basis, does have one of the largest evidence base of being positively associated with a range of functioning outcomes. And on the right-hand side are some strategies that are not part of positive psychotherapy, but they're considered positive psychology interventions, and mindfulness meditation, which some of you have also mentioned, has been the most widely studied. Next. But as I mentioned, there's also been a number of critiques of positive psychology, most of which have centered around optimism and positive thinking, as illustrated in this cartoon, where a dog is engaging in positive affirmation self-talk while he's surrounded by flames. Now, to be fair, many of these interventions were an outgrowth of Seligman's groundbreaking research on learned helplessness. So in that context, changing one's explanatory style and building optimism clearly makes sense. But outside of that context, optimism could also potentially clash with reality. Next. So I do like this quote from gratitude researcher Robert Emmons. To deny that life has its share of disappointments, frustrations, losses, hurts, and setbacks and sadness will be unrealistic and untenable. Life is suffering, and no amount of positive thinking exercises will change this truth. Now, one could even argue that overly optimistic thinking might have contributed to the mess we're in right now. So for example, thoughts of, well, COVID will just go away. Or if I got COVID, I won't get sick because I'm healthy. Or I don't need a vaccine because I'm healthy, or I'm protected. And also trying to build optimism can feel very invalidating when things are genuinely bad. Next. So perhaps it's time to rethink positive psychology interventions. And one way is to revisit the CBD triad. of thoughts, behaviors, and feelings. Now in CBT, the focus of the intervention is typically on thoughts, that by changing maladaptive cognitions, this would result in changes in behaviors and emotions. And the reason to focus on thoughts is that thoughts are more amenable to change than negative emotions. And that makes a lot of sense when we think about the function of negative affect. But when we think about the context of positive psychology, focusing our thoughts, our intervention on thoughts, by which I mean optimism or having a different explanatory style, can be problematic for some of the reasons I've mentioned earlier. So in rethinking positive psychology, it may make more sense to prioritize emotions as our primary target, which may then lead to some changes in behaviors and thoughts. And based on what some of what I presented, not necessarily to change emotions, but to increase positive affect to offset our negativity biases. Next. So I first became interested in positive psychology when I conducted a research study that follows suicidal teens after they were discharged from an inpatient psychiatric unit to see who would be at risk for making another suicide attempt or of becoming rehospitalized 6 months after discharge. And we found that a low positive affect was a surprisingly robust predictor. And on the basis of this finding and on much of the research that I've just reviewed, I developed an adjunctive intervention called Skills to Enhance Positivity. And we've actually conducted a couple of promising pilot trials, which I won't go into here, but they are published. And we're about to launch a larger RCT. And even though STEP was initially developed for at-risk adolescents, I think that the application is quite generalizable. So what is STEP? Well, it is acceptance-based. So the focus is not on changing thoughts or mood states, but rather making room for all of it. And it's specifically focused on increasing attention to positive emotions and experiences that are frequently discounted due to the negativity bias. It's intentional and practice-based. So we use an exercise analogy of needing to practice these exercises on a daily basis to strengthen that reflex or to have this become habitual. Just as swimmers develop muscle memory, we ought to be practicing some of this to make it more second nature. You've probably heard the expression, neurons that fire together, wire together. And to this end, we in the intervention, we supplement individual sessions with an app or automated text reminders for teens to practice their exercises. But this can also be done with a supportive friend to build accountability or support. It's about making small steps that are feasible. People have mentioned that time is often the barrier. This should be something that one can see themselves doing on a daily basis, similar to Gottman's approach of making small deposits into your emotional bank account. We tend to focus on the eudaimonic versus the hedonic. So it's not necessarily about pleasant events or distraction, though those absolutely can be very helpful and they certainly have their time and place. We try to encourage exercises that lead to greater connection with others and are more likely to be generative. And we utilize specific exercises that are consistent with these principles. So none of these practices are actually new. They're meditation, gratitude, and savoring, many of which I see that some of you already practice. But we do provide a lot of psychoeducation about the functions of positive affect and how these exercises support that. And finally, this is not a happiness intervention. Happiness can connote a state of being, which can sometimes feel unattainable and therefore become demoralizing. Next slide. So mindfulness meditation, I'll briefly review some of the strategies that we rely on here. So numerous studies have reported on the benefits of mindfulness or meditation practice, from reducing stress and anxiety and depression to improving cognitive functioning. Now, meditation refers to a family of techniques which have in common a conscious attempt to focus attention in a analytical way. Now, you might think it's paradoxical that a practice that involves being non-judgmental and not attaching valences to experiences leads to more positive states. But it's important to remember that the goal here is to train our attention, which can help us more readily notice these experiences. And it's also important to personalize this to what's feasible to the individual. So there's so many different types of meditation. Concentrative meditation focuses attention to a single point or breath. And mindfulness meditation attends non-judgmentally to whatever enters one's thoughts without getting caught up into it. And integrative might combine elements of both. You can do meditation sitting, standing, or moving. Yoga is a great example of movement meditation. And some people like to attach a phrase to their meditation practice. So that could be a mantra, or it could be extending compassion to self or others through compassion or loving kindness meditation. So there are many ways of practicing. I think the important thing is to identify sort of a feasible practice. Now, gratitude is about building awareness for what we have and can be grateful for. And this can be both big and small things. So a number of positive mental health outcomes have been linked to regular gratitude practice, such as reduced lifetime risk for depression, anxiety, and substance use disorders. Gratitude has been said to serve 3 relationship functions known as find, remind, and bind. So it helps us find new social connections. It reminds us of existing good relationships with partners, friends, or families, and it binds us to stay connected and invest in these relationships. Gratitude can also be an internal experience of reflection, or can be an expression of gratitude, which are particularly powerful in promoting connection with others. So we introduce many different ways of expressing gratitude, including 3 good things, intentional expressions of gratitude, and random acts of kindness. I like to take a pause here and actually do 3 good things exercise. So what this exercise is about is identifying, scanning perhaps the past 24 hours and identifying 3 good things that may have happened. And that could be, again, small or big. It could be an experience you had. It could be, in isolation or in interaction. And if you wouldn't mind sharing that in the chat feature, that would be great. It can allow us to see sort of the variability of responses that you might get. And I'm going to do this as well. Great. These are great. This is great. So a lot of this is about connection with others, and also there's some sense of mastery, helping my son understand his math homework, appreciation for daughter, husbands, dogs, nephew. So I want to share that, just to give a range. One, first, I'm so grateful that so many of you joined us today. I was also grateful that my son drove, my husband drove. I'd be really grateful if my son drove, but my husband drove my son to his first day of school. And I'm also grateful that I hadn't gotten a call from school on the first day of school to allow me to sort of to focus on this presentation. But a lot of this is about small moments and larger moments. So this is wonderful. Thank you. Anyone notice, and you can share, how was it to do this exercises? Easy. Oh, that's great. Oh, good. It made you smile. Wonderful. This is great. I think one of reflective, yes, one of the, I think, the benefits of doing this is it does make you scan your day. It makes you stop and reflect. And maybe some of this, and it's okay if it was difficult, right? Because, and that's also demonstrating that sometimes it might be difficult because maybe we're overwhelmed by some of the negative things that we're feeling, but that if you do scan your day, that they're very, even small things, are likely some things to be grateful for. And so it makes us scan for those things that we probably would have automatically have discounted or just thought, check that off as yes, that happened, and moved on to something that demands more of our attention. Okay, great. And so it's our hope that these small momentary practices of gratitude will build into larger experiences of gratefulness or more pro-social connections. Next. Great. Savoring is another practice. It's a practice of fully enjoying and extending our positive experiences. So by prolonging an experience, it can maximize the impact. So it's being aware of the pleasure in life, no matter how small, and spending time acknowledging those pleasures and purposefully paying attention to them. Even though savoring is most easily experienced as a here and now exercise, you can also choose to savor something in your past or your future. So for example, savoring about the past might involve reminiscing of a good memory, or looking at old photos or memorabilia. Savoring the future might involve anticipating future events or making exciting plans, having something to look forward to. And of course, savoring the present involves deliberately focusing attention on enjoyable experiences that are happening. So savoring food and eating slowly is a common practice. Another way of prolonging positive experiences is to share your positive experiences with other people. Now, sharing good things helps you slow down and process how much enjoyment or pride you may be getting from those positive experiences. And it also builds a connection with others when you share good things. Journaling of positive experiences and memories also serves this function, allows one to look back later in time, especially when things you might feel like it's hard to find good things in that particular day, though it doesn't really have that same interpersonal benefit. So I'd like to try another exercise right now. So if those of you, if you can grab your smartphone and look for a photo that's stored. I'm going to give you a minute to do this and find a photo and just reflect on it for just a minute. And if you can, enter into the chat box what that reflection is evoking in you and what this process has been like for you. Great. Contentment. I wrote amusement because I took a photo of something that I just thought was funny, but it's one of those things where if I just scroll through my photos, I probably would have forgotten it. I wonder, feeling blessed, alive, great. Wonderful. So right, reminders of fun adventures, friends, of one's relevance. These are great responses. And I think that it's just a practice that, I think so many, I'll speak for myself, my own time and attention can get caught up with doom scrolling on my phone, that I think if I were to replace that with a small intentional practice of looking at a random photo that I've saved on my phone, that could make a small bit of a difference. So we've discussed and practiced different ways to intentionally practice these momentary exercises to sort of bring greater attention awareness to positive affect and experiences. And the hope is that these will be generative. And now I'm going to hand it off to Cheryl to talk about sort of the longer term perspective of growth and resilience.
Yes, in fact, we know from the disaster trauma research that resilience is actually more of the norm than illness. We have evidence that has consistently been found that more than 2/3 of people are resilient and actually return to their previous level of functioning after exposure to a traumatic event. And in some cases, not only do they bounce back, but there were positive and radically transformative outcomes following a crisis event. And that is what Tedeschi and Calhoun distinguished as post-traumatic growth, which can happen at both a personal and professional level. So healthcare workers in the SARS and Ebola crisis, for example, have cited experiencing that they found their work to be really rewarding and meaningful, that they could make a significant impact to the lives of others. They were more connected to their community. They felt more committed to living a full and valuable life. They felt more competent in their professional role as well. And according to Tedeschi and Calhoun, these positive outcomes can be summarized into the 5 domains pictured here. And I'll start from the top right. During this pandemic, COVID has been the change catalyst that has really shown a light on the human capacity for strength and resilience. Many healthcare workers have remarked about how incomprehensible it is that they were capable of doing and enduring so much, of showing up for their patients and for their communities in the face of adversity. COVID has also catalyzed new ways of connecting and relating, and we prioritize our close relationships more. Some of us may have found also a greater appreciation for life in the face of mortality, valuing things that we usually take for granted. And I love all the moments that we were grateful for. It really ranged from all the small gestures. And COVID may have also made us explore And for some, it could have also been a very spiritually transformative time, whether it strengthened one's faith and belief in a higher power, made us connect more with our religious practices and communities, or we may have resonated more strongly with our personal meaning of life, self, and purpose. And all these aspects of post-traumatic growth come with positive emotions that we can notice and attend to, such as feelings of pride of oneself and others, feelings of competency and achievement, connectedness and love, being cherished and valued in our professional and personal lives, gratefulness and appreciation, as we've talked about, openness to experience, and feelings of expansion and feelings of deeper security as well. And these positive emotions can be attended to in daily moment-to-moment practices, as Shirley had illustrated. And it is this intentional daily practice that can possibly help facilitate and reinforce the long-term recovery and resilience and help us make meaning of a challenging time. As we come to the end of this presentation, one key takeaway that we want to emphasize is how the momentary intentional practices can foster resilience and recovery in the long term. And you can reflect and indicate in the poll which positive psychology practice you think you can and would like to feasibly incorporate as a daily practice. We see about 50%, for gratitude, 30% for savoring.
Well, thank you so much for doing the poll. And I also want to be mindful of the time. As Cheryl mentioned, we hope that you'll see this sort of as a continuum of how engaging in momentary practices can build the groundwork for eventual post-traumatic growth when one is at a point in which they are ready for that. I do want to, next slide, please. In keeping with theme, I want to also offer acknowledgements. Thank you to Jackson Doer for assistance with the slide presentation and NIMH for funding the development step. And especially want to thank the healthcare workers who show up day in and day out through these difficult times. And I want to leave time for questions. So please share any questions you might have. Thank you. Yes, we will share the slides after the presentation. And if you do have a question, please enter it into the chat feature, or Vanessa, I don't know if you're looking at, you can also indicate.
There was a question earlier on from Antonio asking Shirley that, STEP was developed for at-risk adolescents. What types of issues or problems were STEP addressing?
Oh, right. So yes, I think that what we were trying to address with the adolescents was to try to develop sort of an innovative adjunctive intervention, right? Because I think that that would sort of, I considered it a foot in the door intervention, in that adolescents who were in crisis often had a hard time either accessing treatment or did not want to engage in treatment because everything was focused on sort of their risk factors or the behaviors, or on things that they couldn't control, like their family environment. And what I saw, what I was really thinking too, and a lot of this is about increasing self-efficacy. What are the things that you can control? So I think that was one of the target was sort of to try to build resiliency in a way that adolescents could engage in. So that was sort of one of my premise. But I think that really in many ways it's quite generalizable, right? Because whether it's adolescents who might be resistant to treatment or people who are too busy to really engage. I sort of see this as building, as I mentioned, sort of like a foot in the door of small feasible steps that can lay the groundwork for perhaps more reflective interventions at a later point. Yeah, interesting. And what difference between positive thinkers or resilient people? So I think that this gets to what I was mentioning about some of the criticisms directed towards positive psychology, in that I think positive thinking has its time and place and can be very, and I think would be a very important intervention for some folks. But at the same time, I do think that resilience, I think that resilience is about, I think, accepting and the positive and the negative. That it's, I think that, you know, in some cases, optimism may not necessarily be aligned with reality. And that's the great, I think, the risk that we have to think about when we think about positive psychology interventions. It's not that I'm against optimism or positive thinking, but I do think that, you know, reframing this in a way that sort of focuses on positive affect, gratitude, savoring, I think is perhaps, and I think we have to do more studies to validate this approach, but it may be a more, I think, palatable approach for many. I'm getting so many comments now, it's hard to keep up. Exactly, optimism is only one type of tool, but it's not a, you know, it's not for all situations. Yeah, I think that I do think that we need an alternative to cognitive-based approaches. So I was also thinking that as well. I think the question was that you create a step because generating positive emotion was more protective than certain cognitive approaches. I think it's about having more innovative ways of approaching mental health care crises. When they're feeling tired or shut down, how do you encourage someone to do these exercises? Again, it's by making it very feasible, that if I can find 15 minutes to doom scroll on Twitter, I can probably make a few minutes to look at a photo that reminds me of the beauty of nature, or family members, or connect with loved ones. It's about saying that, well, you know, mindfulness meditation practices, it doesn't have to take half an hour, that you can do things in small increments and still sort of make a difference. So we have a lot of great questions, and I think if and many wonderful comments. And I just want to encourage, if you want to reach me and continue the conversation, feel free to email me. But I'm mindful of the time, and I know that you know, Vanessa, you wanted to mention, or Courtney, future presentations. So, Cheryl, can you advance the slide?
Yes. Thank you all for attending today's webinar. You will be receiving an evaluation form right afterwards, and we have a few upcoming events. Please feel free to register if you're interested.
Great. Thank you, everyone.